Rosenberg, Texas was hit hard during Hurricane Harvey when the Brazos River overflowed its banks.
Some houses had maybe 4 to 6 feet of water in their house. Some of them are completely underwater, especially those on the river and the floodway. And anything that got wet is no good anymore because of the mold.
And I'm supposed to see a new doctor on Friday when the hurricane started.
The International Project Hope and local San Jose clinic have brought together medical volunteers to assist the citizens of Rosenberg with their post-Harvey healthcare needs.
Thank God for the San Jose clinic because we did need some help with their emotional problems. And then, of course, with the medical help, it's very hard because many of the people are undocumented.
Hope contacted me and asked if I could come at the beginning of it, and so that's how I'm here. I came in with the lead group and have been here, and we'll probably be here for about another 2 weeks till the end of September. We're doing a collaborative effort with the Massachusetts General Hospital, and a number of their excellent nurse practitioners are here working with us, so it's a collaborative effort. So we're able to stretch out the types of care that we're giving. We're seeing patients that are not acutely injured or ill for the most part, but they're stressed. And then the rest of it is typical aches, pains, problems. Most of them are poor, cannot afford medicine. They're coming in because they've heard they'll be able to get medicine and be seen. They'll have diabetes, but they haven't taken medicine for a month because they don't have medicine, or it was lost in the house that was flooded. No money to buy the medicine, that type of thing.
So after 2 weeks of not taking your blood pressure, your diabetes medications, we're seeing patients come in with systolic blood pressures above 200. We're seeing people come in with blood sugars over 500, and they're clinically symptomatic with that. And so an exacerbation of a chronic illness can very quickly become an acute or critical care issue.
Shortages of prescription drugs has been a challenge for these pharmacists.
You know, this is it. Like, I have 1 tablet of that medicine. These are all the blood pressure medications we have. And with the populations that are coming in, it's like every other prescription is for high blood pressure medication.
You actually have to get back to whoever is going to be your doctor for this. Okay.
And we're trying to get people referred, if they can travel a little bit, either to their own doctor or to a clinic that they have gone to.
Beyond their physical needs, there is an underlying emotional trauma that the patients must face.
They went through this a year ago with another flood, so as discouraged as it can be to have this flood, and some of them have said, when's the next flood? One of the most important things is to ask, what is your story? Please tell me your story. Tell me what's going on, and listen, actively listen. And so they're being able to tell the story to somebody like a nurse, a doctor, a priest, a deacon, somebody like that, helps to unload initially, and then to be able to say, well, have you got family, have you got friends? You start working on how to build a support structure. And we use some medicines when that's also necessary.
They've been through this before. We know how to do it. And yes, they're hurt, they're angry, they're upset, but they're people of faith. They're people of great faith. And so they say, well, okay, we know what's next.